Welcome to Good Health, Good Life channel. Do you know about the most recent outbreak called Mpox? How has Mpox spread beyond its original regions, leading to global outbreaks? How dangerous is Mpox? What are the symptoms and prevention? Stay with us until the end to get all the essential information about this dangerous outbreak and learn how to protect yourself and others. Mpox, previously known as monkeypox, has emerged as a significant public health concern with increasing global impact. Once confined to specific regions in Africa, Mpox has now demonstrated its potential to cause widespread outbreaks across continents. In this video, we'll delve deep into various aspects of Mpox, including the history and current status of outbreaks, the symptoms to watch for, how it spreads, the steps we can take to prevent it, and the critical role of vaccines. We'll also explore recent developments and publications and discuss the future possibilities as scientists and public health experts continue to monitor and study this evolving disease. History, from local to global concern. Mpox was first identified in laboratory monkeys in 1958, which led to its initial name. The first human case was reported in the Democratic Republic of the Congo in 1970. For decades, Mpox remained a largely regional issue, with sporadic outbreaks in Central and West Africa, often linked to contact with infected animals. However, the situation began to change as the world became more interconnected. In the early 2000s, isolated cases were reported outside Africa, primarily due to the importation of infected animals. The 2022 global outbreak marked a turning point, with Mpox spreading rapidly across continents, particularly in Europe and North America. The outbreak highlighted the virus's ability to spread through human-to-human contact, raising concerns about its potential for widespread transmission. Most recently, as of July 13, 2024, Ontario, Canada, experienced a sharp increase in Mpox cases, with 102 confirmed cases from January 1 to July 13, 2024. This is a significant rise compared to the 33 cases reported in all of 2023, indicating a resurgence of the virus. Meanwhile, in August 2024, the World Health Organization, WHO, declared a public health emergency of international concern, PHEIC, due to the rise of Mpox cases in the Democratic Republic of the Congo and other African countries, driven by a new and concerning clade of the virus. These developments underscore the ongoing threat Mpox poses to global health and the need for continued vigilance and coordinated action to control its spread. Symptoms. Recognizing the symptoms of Mpox is crucial for timely diagnosis and management. The disease usually begins with nonspecific symptoms that can easily be mistaken for other viral infections, such as the flu. These initial symptoms include fever, headache, muscle aches, and fatigue. A key distinguishing feature of Mpox is the swelling of lymph nodes, known as lymphadenopathy, which is not typically seen in similar diseases like smallpox. As the disease progresses, a characteristic rash appears, usually within 1 to 3 days after the onset of fever. The rash typically begins on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. The rash goes through several stages, starting as flat, red spots called macules, which evolve into raised lesions known as papules, then into fluid-filled vesicles, and finally into pustules that crust over and form scabs. The severity of Mpox can vary widely. Most cases are mild and resolve on their own without specific treatment. However, severe cases can occur, especially in young children, pregnant women, and individuals with weakened immune systems. Complications may include secondary bacterial infections, respiratory distress, and, in rare cases, encephalitis, which is an inflammation of the brain. Understanding these symptoms is essential for healthcare providers and the public, especially in regions where Mpox is spreading. Early recognition can lead to quicker isolation and treatment, reducing the risk of transmission. Transmission. How Mpox spreads. Mpox is a zoonotic disease, meaning it is transmitted from animals to humans. The primary reservoirs of the virus are rodents, such as rope squirrels and Gambian pouched rats, as well as certain primates. Humans can contract the virus through direct contact with the blood, bodily fluids, or skin lesions of infected animals, and in some cases, through the consumption of undercooked meat from infected animals. Human-to-human transmission occurs mainly through direct contact with the lesions, bodily fluids, or respiratory droplets of an infected person. This can happen during close face-to-face interactions, sexual contact, or through contact with contaminated objects like bedding or clothing. In the most recent outbreaks, particularly the 2022 global outbreak and the ongoing situation in 2024, transmission through sexual networks has become more prominent, especially with the emergence of a new clade, 1B, in the Democratic Republic of the Congo. While airborne transmission is possible, it typically requires prolonged close contact. The virus can enter the body through broken skin, the respiratory tract, or mucous membranes, such as those in the eyes, nose, or mouth. The evolving patterns of transmission, particularly the role of sexual networks in spreading the virus, highlight the need for targeted public health interventions and community awareness to prevent further spread. Prevention strategies to protect against Mpox. Preventing the spread of Mpox requires a multifaceted approach that includes vaccination, public health measures, and individual protective behaviors. Vaccination remains one of the most effective tools in preventing Mpox. The smallpox vaccine, due to its genetic similarity to the Mpox virus, provides cross-protection. The MVA-BN vaccine, also known as Imvamune RR, or Jynneos, is currently the most widely used vaccine for Mpox. It is administered in 2 doses and is effective in preventing infection or reducing the severity of the disease. In Ontario, as of mid-2024, there is a concern that only 35.6% of individuals who received the first dose of the Imvamune R vaccine have completed the 2-dose series. This gap in vaccination coverage is critical, as full vaccination is necessary for optimal protection. Public health units are actively promoting the completion of the 2-dose series, especially in areas experiencing a surge in cases, such as the Greater Toronto Area and Ottawa. In addition to vaccination, personal hygiene practices are vital. Regular hand washing with soap and water, avoiding close contact with infected individuals, and using personal protective equipment in healthcare settings are effective measures to prevent the spread of Mpox. Public health authorities continue to emphasize the importance of these practices, especially in high-risk communities. Public health interventions, including surveillance, contact tracing, and public education campaigns, are essential to control outbreaks. By identifying and isolating cases early, health authorities can prevent further transmission and protect vulnerable populations. Vaccines, a key defense against Mpox. Vaccines are a cornerstone in the fight against Mpox. The MVA-BN vaccine, also known as Imvamune R or Jynneos, is the most commonly used vaccine for Mpox today. This vaccine is a 3rd-generation, non-replicating vaccine that is safer and more effective than earlier smallpox vaccines. It is administered in 2 doses, and completing the series is crucial for full protection. In Ontario, the push to increase vaccination coverage is ongoing, particularly as the region experiences a resurgence in cases. Public health officials are urging those who received their first dose to complete the 2-dose series, especially in areas with higher case numbers. Globally, The World Health Organization is working to accelerate vaccine access, particularly in lower-income countries affected by the new Mpox clade. WHO's efforts include an emergency use listing process to make vaccines more widely available and equitable distribution to ensure that the most vulnerable populations are protected. Vaccination not only helps prevent infection, but also reduces the severity of the disease in those who contract it. For individuals who have had a confirmed Mpox infection or completed the 2-dose vaccine series, current guidelines suggest that no booster dose is required. The global effort to increase vaccination rates and ensure equitable access is crucial in controlling the spread of Mpox and preventing future outbreaks. Recent publications and developments. Recent publications and reports have provided valuable insights into the evolving Mpox situation. On July 13, 2024, Public Health Ontario published an enhanced epidemiological summary, highlighting a significant increase in Mpox activity in the province since January 2024. The report emphasizes the importance of testing and vaccination, particularly in high-risk areas like the Greater Toronto Area and Ottawa. Meanwhile, the World Health Organization's news release on August 14, 2024, declared Mpox in the Democratic Republic of the Congo and other African countries a public health emergency of international concern, or PHEIC. This declaration was prompted by the emergence of a new Mpox clade, 1B, which is spreading rapidly through sexual networks and posing a significant threat to public health in the region. These publications underscore the ongoing challenges posed by Mpox and the importance of a coordinated international response. They also highlight the need for continued research and surveillance to better understand the virus and develop more effective interventions. Future possibilities. What the future holds. As we look to the future, the fight against Mpox is far from over. The recent increase in cases and the emergence of new clades underscore the need for continued vigilance and research. Scientists are working to better understand the virus's behavior, including its transmission dynamics and potential mutations. One of the key areas of focus is the development of more effective vaccines and treatments. While the current vaccines provide substantial protection, research is ongoing to improve their efficacy and accessibility, especially in regions with limited resources. Another critical area is the global response to Mpox. The World Health Organization has called for increased funding and international collaboration to prevent the further spread of the virus. This includes strengthening surveillance systems, improving access to vaccines, and ensuring that public health measures are implemented effectively in all regions. As Mpox continues to evolve, the global health community must remain proactive, adaptable, and committed to controlling the disease. With ongoing research, innovation, and international cooperation, we can hope to mitigate the impact of Mpox and protect the health of populations worldwide. Mpox may have started as a regional concern, but today it is a global challenge that demands a global response. By staying informed, promoting vaccination, and supporting public health initiatives, we can all play a part in combating this disease. Stay safe, stay informed, and let's work together to build a healthier future. Thank you for watching. If you found this information valuable, don't forget to subscribe, share, and like to stay informed with more important health updates in the future. Disclaimer: the information provided on this channel is for educational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Viewer discretion is advised.